Okay, well, again, welcome to today's webinar, hosted by the Robert Wood Johnson Foundation Systems for Action Research Program. Today, we're going to be talking about the recently released 2022 Call for Proposals for the Systems for Action Research Program. Thank you again to everybody for joining us. Quick overview of our agenda today. We'll be talking through the RWJF Systems for Action program, giving you a brief overview of this research program in general, and then talking more specifically about the 2022 Call for Proposals that was released last month. We'll talk through the logistics of that proposal, special areas of interest, what kinds of characteristics might make for strong proposals to this program. And then, of course, we'll talk through the mechanics of how to apply for those of you who might be new to the Robert Wood Johnson Foundation and its grant-making process. And then we will make sure to leave time today toward the end of our hour for to hear from you, hear your questions, and be able to answer those. So definitely stay tuned and hang on for the latter portion of our call for that Q&A session. A few housekeeping issues. Number one, we are recording this session, and after today's session, we will post a link to the slides and the recording. We'll send those links to everybody who registered for today's webinar. If you've got your email address entered there, you'll get an email out from us. And we'll also post the slides and recording on the Systems for Action website at the URL that you see here, systemsforaction.org. This is a large webinar. We have more than 400 people with us today. So for that reason, everybody's going to be muted during the webinar. All the attendees are muted. You won't be able to physically verbalize during the webinar, but you can submit your questions by typing them in to the Q&A box, which you should see down at the bottom center of your screen. Not the chat box, but the Q&A box. Please, that'll help us manage the questions in the Q&A portion of today's session. So please, you can submit those at any time. So whenever a question might pop into your head as we move along today, feel free to submit those, and we'll work through them. And we thank you for that. So a little bit about the Systems for Action Research Program. This slide shows you our leaders at the Robert Wood Johnson Foundation who oversee this program, including Carolyn Miller, Senior Program Officer with the Research Evaluation and Learning Division, and also Dr. Jackie Orr, also Program Officer with the Research Evaluation and Learning Division. Dr. Orr is with us today if we need to hear from the Foundation specifically about the program or any questions where we will need RWJF insight. We're fortunate to have two very talented leaders at the Foundation for this program. We also have a national program office for the S3A program that is based at the University of Colorado. That's where I'm coming to you from. I've got the privilege of directing our national program office here. I'm a professor at the University of Colorado in the School of Public Health, and very fortunate to have a number of colleagues here in Colorado that work with me and that staff our national program office. Most of whom are also with us on the call today, including Carrington Lott, our program manager, Sadina Belmashkin, who's our communications coordinator, and Lene Bounds, who's our business services program manager. And so if you do proceed with submitting an application to the program and interacting with us in other ways through the S3A program, you will certainly interact with these and other members of our National Program Office staff. So a bit more about the S4A program. Systems for Action is a signature research program of the Robert Wood Johnson Foundation that is designed to help us learn about how to better connect and align medical, social, and public health systems in ways that can advance the cause of health equity. We're a research program, so we support rigorous scientific research, testing new ways of connecting medical, social, and public health delivery systems, as well as financing systems that operate in those three broad sectors, helping us learn how to help those sectors and systems work together toward the cause of health equity. And this program has been up and running since 2015. Lots more information about the program is available on our website, including a research agenda, which guides all of the work of this program. It's been updated over time. You can see the most recent update of that research agenda on our website. You can see examples of the other research projects and studies that we funded to date through this program. More than 30 studies funded over the history of this program so far. You can get access to our research in progress webinars that we host and that we archived on the website. Also access other products from studies supported by S4A, all on the website. Definitely encourage you to spend some time there if you haven't had a chance to do that yet. So the 2022 call for proposals. Our Systems for Action program has been in the habit of releasing a call for proposals approximately annually since its inception. And so we released the 2022 iteration of the call for proposals last month, back at the beginning of July. And most years when we release the CFP, we do integrate some changes and innovations in terms of focus areas for research that we are particularly interested in funding and receiving proposals for, based on what we're learning, what we've learned from past studies, and emerging priorities in the field of practice and policy. And so if you've seen earlier iterations of our call for proposals released in earlier years, please make sure that you read the 2022 CFP released last month as well, because it does contain some new information, new focus areas of interest for research in this program. But many things are consistent through the Systems for Action program. Number one, we focus on funding studies that attempt to address an important health equity problem and to address the needs of the affected communities and populations affected by that health equity problem. So overarching health equity focus, very, very important. Secondly, here, this is a consistent part of our program from the very beginning. We study ways of aligning and integrating public health, medical, and social systems, the delivery systems and the financing systems that operate in those three broad sectors. And so we're looking for studies that are proposing innovative ways of helping those systems to work together to solve the health equity problem of interest. Number three, we're interested in studies that evaluate the feasibility and/or the impact of a novel alignment strategy using scientific rigorous research designs. And we're a research program, and so we are interested in strong scientific studies that can answer questions and produce evidence that's broadly generalizable to American communities. This year, for the first time in our call for proposals, there are two categories of awards that you can apply for. The first category award is for a developmental or feasibility study to test a novel alignment strategy that hasn't yet been tested. The second category of award is for a larger study that is designed to evaluate the impact of the alignment strategies that's being proposed and to estimate the causal effects of the alignment strategy on the health equity problem of interest. So you've got two categories of awards this year to choose from in submitting applications. The number 4 bullet point here, this is an area that is a new area of emphasis this year in the CFP, and that we are explicitly interested in studies that will evaluate the extent to which the proposed alignment strategy is successful or has potential for success in dismantling forms of structural racism and inequity that are embedded within delivery and financing systems operating in the three sectors that we're interested in. So this focus on structural racism and inequity, it's always been an interest of the S4A program. In this year's call, this is a primary focus of the call, is in system alignment strategies designed to dismantle those forms of structural racism and inequity embedded within systems. We're obviously very interested in research teams, multidisciplinary research teams that have theoretical, methodological, and operational practical expertise that's directly relevant to the system alignment strategies that's being proposed. And so usually this requires a diverse multidisciplinary research team to bring together all of the right elements: theoretical, methodological, and practical operational expertise that's relevant. We are a 4-action research program, which means we're interested in funding studies that can produce findings that can be immediately put into action by stakeholders who work within medical, social, and public health delivery systems. And that requires authentic community engagement methods, being able to engage communities and stakeholders in the conduct of the study. So that's another very, very important element of studies that we're looking for: strong community engagement methods, and then correspondingly strong research translation activities that are built into the study design. Activities that are designed to help relevant community stakeholders make use of the scientific knowledge that is being produced by the study to actually align the medical, social, and public health systems that are serving their communities. The last bullet point on this slide is another kind of new area of interest that we've articulated in this 2022 call for proposals, and that is we're especially interested in studies that are designed to address one or more of the 5 areas for future development that are described in this year's call for proposals brochure. And these are 5 areas for future development of system alignment strategies that our program has identified, based largely on studies that we funded in the past, as well as studies that are currently ongoing, to helping us learn about continuing areas of uncertainty around how to help medical, social, and public health systems work better together. So these 5 areas of future development are described in the CFP. I'll talk about them in a little more detail here just in a minute. And so that's something to take a close look at. One of those 5 areas of future development actually relates to a set of recommendations issued recently by the Robert Johnson Foundation National Commission to Transform Public Health Data Systems. So we're again especially interested in studies this year that incorporate one or more of those recommendations for transforming public health data systems to make them equity-driven public health data systems. So in responding to this year's CFP, definitely encourage you to take a look at the report issued by that RWJF National Commission back in the fall, and think about how your idea for system alignment might relate to one or more of those recommendations. So in any event, you're going to want to take a close look at the funding opportunity brochure. That again, there's a link to that brochure at the bottom of this webpage. I'll be emphasizing that throughout the remainder of this webinar. It's 11 pages, a lot of good detail about what kind of studies we're really looking for, really hoping to see in this year's 2022 call for proposals. Okay, let me talk a little bit more about those special areas of interest for proposals for this year, 2022. I mentioned already, we're interested in studies that specifically look at ways of dismantling structural racism embedded within delivery and financing systems that operate across medical, social, and public health sectors. We articulated a set of 5 areas for future development in the CFP. Those are listed here as well in these subsequent bullet points. We're looking for studies of system alignment strategies that explore ways of expanding the availability and quality of social services and supports within the community, rather than focusing narrowly on screening and referrals to existing community resources. Growing body of evidence saying that just screening for unmet social needs and referring people to available resources often is not enough to tackle these problems in terms of social determinants of health. So we're interested in studies that can look at ways of expanding availability and quality of community services and supports. Related to that, we're interested in studies looking at system alignment strategies that explore ways of reallocating and repurposing resources from the medical sector to address gaps within the social services and or public health sectors, recognizing the inequities in resources, imbalances in resources across medical, social, and public health systems. So interested in reallocation and repurposing functions that can be built into system alignment strategies. As well, we're interested in system alignment strategies that are designed to give social and public health sectors greater voice and authority in collaborative multi-sector work that's designed to address health inequities, recognizing that there are often imbalances in power and authority and control when looking across medical, social, and public health systems, with social and public health systems often having lower levels of decision-making authority and power within multi-sector collaborative work. So we're interested in alignment strategies that can kind of rebalance power, voice, and decision-making authority within these types of collaboratives. We know that from our own research in S4A, as well as in others' research, that communication and information exchange across medical, social, and public health systems are still frequent sources of friction and challenge and problem. And so we're interested in studies that can explore new ways of enhancing communication and information exchange across those three sectors, medical, social, and public health systems, toward the end of working together to tackle health equity issues. We're also interested in learning a little bit more specifically about the public health sector's roles in these multi-sector collaboratives and system alignment strategies, and interested in alignment and studies of alignment approaches that are designed to engage the public health sector more meaningfully and more deliberately in multi-sector collaborative efforts to address health equity, recognizing that public health often is left out of these collaboratives. And in the context of the COVID-19 pandemic over the last several years, public health is often in a diminished position to engage on these kind of initiatives. So we're looking for studies to test some innovative ways of addressing that problem. And then last bullet point here on the slide, again, reference to the RWJF National Commission to Transform Public Health Data Systems. We're interested in studies that can test ways of implementing one or more of the recommendations of that commission as part of multi-sector system alignment work. And those recommendations relate to how to create more equitable data governing structures for overseeing public health data collection and use, recommendations around how to capture more accurate and granular data on race, ethnicity, language, and other social constructs relevant to health equity, and recommendations that are designed to ensure that public health data systems capture and address structural racism specifically in the data systems, along with other forms of inequity. Again, more details on all these special areas of interest are described in the funding opportunity brochure. So please take a close look at that when you have a chance. So characteristics of successful proposals submitted to the Systems for Action Research Program. Well, some of these we've already touched on. Number one, you got to have a proposal that proposes to study an alignment strategy that engages all three of the sectors that our program is focused on: medical care, public health, and social services. We use broad definitions for those three sectors. Take a look at our definitions. They're spelled out in the Systems for Action frequently asked questions document. That is, you'll see a link to that in the call for proposals document and on the RWJF webpage, as well as the Systems for Action website. We're looking for studies that have a clear and convincing logic model describing how the alignment strategy they're proposing to study will actually address health equity problems and will dismantle forms of structural racism and inequity. We're looking for proposals that spell out a rigorous and clearly specified scientific research approach, covering data sources, measures, analytic methods. We're looking for studies that have a focus on measuring and achieving change at the systems level in dismantling structural racism and inequities. So we're looking for studies that actually examine and test for system level change in how medical, social, and public health systems operate and how they work together. Not just looking at individual person level or patient level change or impact, but we want to studies that are designed to measure impact at the system level. And then finally, as I've mentioned several times, it's a 4-action program. So we're looking for proposals that have a strong strategy for helping other people access and use the findings that will be produced by the study. So this concept of designing your study for dissemination at the beginning, thinking about who the audiences are, who the stakeholders are that can act on these findings, and making sure you've got approaches built into the proposal to help those stakeholders engage in the study, access findings, and use the findings. I mentioned earlier that's one of the new things for this year, 2022, is these 2 categories of funding that are available. One of the first things you need to decide is to which category to apply for. If your study can only apply for one of these categories, either the Developmental Study Award or the Impact Study Award. Developmental Study Award category, the proposals that are funded in this category will receive up to $100,000 in total funding. And that funding is designed to be used for pilot testing and feasibility testing of a new system alignment strategy that hasn't been implemented yet, hasn't been previously pilot tested and proven to be feasible. The funding can be used for up to 12 months, a period of up to 12 months to conduct the research, pilot testing activities, and the translation dissemination activities. The foundation plans to fund up to 5 studies in this developmental category. The second category is impact studies. These are the larger scale studies. Each one will receive up to $500,000 in funding to evaluate the impact of the system alignment strategy being studied on relevant measures of health and health equity. These studies can be for durations of up to 3 years, 36 months, to conduct the research and the translation dissemination activities. The foundation anticipates funding up to 4 studies in this category, the impact study. Very important for the impact study category. To apply for this category, you must have completed already a pilot study of your proposed system alignment approach. And you must have documentation of the results of that pilot study that demonstrate the feasibility of the alignment approach that you want to study and its acceptability to key stakeholders. So impact studies are really only for teams that have already conducted a pilot study of their system alignment approach. They've got documentation that it's feasible, that it's acceptable to their stakeholders, and they're now ready to move forward and test the impact of the study. If you're not there yet, if you don't have pilot test study results and feasibility test results for your system alignment idea, then you're certainly better off to focus on the Developmental Studies Award to conduct that feasibility testing as a first step. And that then could put you in a good position for future years to apply for an impact study type of award from our program, or to apply for other funding to test the impact of your alignment approach. Importantly, this is a research program, so we expect that grantees will use funds primarily to support research activities rather than to support the implementation of the proposed alignment strategy. If you have any questions on that, you can submit them today, or submit them to our research program offline via email, and we're glad to talk through those issues in greater detail. Some key resources just to make sure that everybody's aware of and have access to. The first bullet point here is just a link to the landing page on the Robert Wood Johnson Foundation website that explains the 2022 System for Action call for proposals. That landing page has got all these other links here, links to lots of helpful resources to help you craft your proposal. And importantly, it's got the links, the buttons that will take you to the Robert Wood Johnson Foundation application submission system, which is where you will electronically upload and submit your application. The full 11-page funding opportunity brochure, that's the second bullet point here. I've mentioned it several times. make sure you take a look at that. Lots of important details there, spelled out in greater detail on that brochure. Third, we do have a frequently asked questions page devoted specifically to the S4A program and to this 2022 CFP. That is, you can find that on the Systems for Action webpage, showing it the third bullet point here, the URL. There's also references to that FAQ page in the CFP funding opportunity brochure and on the RWJF landing page. So you can find it multiple ways, but there's lots of good information there as well. I mentioned already our S4A research agenda, a good source to look at to get a better sense of the overall purpose and priorities of the S4A research program. And then lastly, we invite you to get on the S4A website and look at some of the types of studies that we funded previously, just to get a sense of what's already been funded, what kinds of findings already exist, and how your idea might fit into this larger portfolio of research. And so you can see descriptions of all of the previous and current S4A studies on that website, systemsforaction.org/our-research. Okay, just a few more things I want to cover, and then we're going to get to Q&A portion. Just a few issues, more nuts and bolts about how to access resources and how to submit your application. Again, please carefully read that full 11-page funding opportunity brochure. You can access it from the landing page on the RWJF website. This is a screenshot of what that landing page looks like. You can see there on the right-hand column, there's some key documents. There are the green buttons where you click to submit your applications. And then there's key materials down here at the bottom, including a link to the full funding opportunity PDF. That's what you want to make sure to, don't overlook that. Click on that, download a copy of that, as well as a link to frequently asked questions. I do also want to call your attention when you read that 11-page funding opportunity brochure, you will see that there are a set of 6 selection criteria that our program will be using to review and evaluate all the proposals that are submitted. And ultimately, we'll use these criteria to make recommendations about funding, which applications are recommended to receive funding. So you want to take a close look at those 6 selection criteria. And as you develop your proposal, make sure that you're responding to those selection criteria. Make sure you're writing in your application how your idea meets each of those 6 selection criteria. So those selection criteria are described on pages 6 and 7 of the CFP. And we're looking at a screenshot of just the first 2 of those selection criteria. Make sure you take a close look at that and make sure your written proposal document clearly explains how your idea meets those 6 selection criteria. There's also in that funding opportunity brochure on pages 8 and 9 a paragraph that tells you specifically what to make sure to include in your proposal narrative, your 10-page written proposal narrative. So I want to call your attention to that. It's at the bottom of page 8 to the top of page 9. It gives you a numbered list of about 8 things to make sure that you include in your written proposal narrative. So just make sure you read that closely, and as you're developing your application, your proposal, toggle back and forth to that. Make sure you're hitting all those elements that we need to see in your application. I know that on eligibility, this is we follow standard eligibility policies of the Robert Wood Johnson Foundation and the Research Evaluation and Learning Division. This funding opportunity is limited to primary applicants that are public entities or nonprofit organizations that are tax exempt under the 501c3 section of the IRS tax code. The primary applicant also needs to be based in the U.S. or one of its territories. We certainly welcome collaborations, welcome multiple organizations to come together and partner, collaborate in a consortia to apply for funding. But in that case, if you're applying as a consortia or a partnership of multiple organizations, you must select one of those organizations to be the primary applicant for the grant. And that primary applicant needs to meet these eligibility criteria of being a public entity or nonprofit based in the U.S. or its territories. Okay, just a few quick notes on the application process. There are 2 dates that are shown on this slide. Please keep these dates in mind. The first one coming up next month, September 6th, and that's the date for submitting an optional, non-required, 1-page letter of intent. It's not required. You don't have to do it, but it is in your best interest to do it, we think. It's an easy little 1-page letter of intent. It tells us your working title, a brief description of your anticipated research approach. You list out who the participating investigators and institutions are. Tell us which award you're applying for, the Developmental Award, the Impact Award. Again, it's not required. If you don't do it by September 6th, no big deal. You can still submit your proposal, but it does help you because it helps us anticipate what your application is going to be about. And then it helps us make sure that we have external reviewers who have been recruited, who have expertise relevant to the topic of your application. So we really encourage you to submit that 1-page LOI. It's non-binding. You can submit something and then change what you're doing to some extent. You know, that's by the time you submit your final proposal, that's no problem at all. All it does is gives us an initial idea of what your proposal is likely to be about so that we can recruit relevant reviewers to review your proposal. That's the first date. The second date, the big date, the final date that really is binding and we have no flexibility about is October 5th. That's the deadline for submission of your full application. The deadline is at 3 p.m. Eastern Time on October 5th, 2022. You need to submit your full application via the RWJF online system that's linked to here. It's those green buttons on the landing page of RWJF will take you there. The bullets you see down here below October 5th, these are the elements you'll need to submit as part of that process. You fill out some pages of applicant information about your organization, the PI, principal investigator, any co-PIs. You'll put in your title and your project summary. You will submit your 10-page proposal narrative. You'll also submit a budget worksheet and a budget narrative describing how you will use the resources available. And you'll also upload several supporting documents that are listed out here at the very last bullet of this slide, including CVs or resumes for key personnel, up to 5 people, a timeline for your proposed activities, and then very importantly, number 3, letters of support from each collaborating organization. Every organization you're proposing to collaborate in your study needs to submit a letter of support from that organization describing and confirming their roles in the study and their willingness to do that. This includes, you need to have a letter of support from each organization that is proposed to submit data that you plan to use for your study. If you are planning to use data that are owned and managed by some other entity besides your own organization, that's fine. That's a pretty common thing to do, to use data provided by other sources. But if that's your plan, you need to have a letter of support from each organization that is proposed to contribute data into your study, confirming their willingness to provide the data. The last element here, item number 4, is only relevant to people who are submitting the second category of award, the Impact Award category. And for those awards, you need to submit documentation of pilot test results. Again, that only applies to applicants for the Impact Studies Award. Okay, this slide just gives you a reminder of those 2 key dates. September 6th for your optional non-binding letter of intent. October 5th is the final deadline, 3 p.m. Eastern, for submission of full applications. There's no flexibility, unfortunately, on that date and deadline. And we'll, as a warning, the volume of submissions can get pretty high on that last day. So we encourage you to start uploading and start submitting your application earlier in advance. Don't wait to the 5th of October if at all possible. Because if you run into a snag at the last minute and need a question answered, our staff may not be available in that last 24 hours before the submission deadline, just because of the high volume of other applications coming in. So we'll try our best, but please plan on submitting in advance of that October 5th deadline. You can upload documents in the application system as you go, as you complete things, and you can always revise those documents until you hit that final submit button. So it's good to start work early on your submission, so you don't run into a technology snafu or something else that can be a problem. Last point, we will be offering a series of weekly virtual office hours for anyone who's interested in this opportunity, who's working on an application. You can drop in via Zoom to our weekly office hours and ask a question. We welcome you all to do that. We've got these dates scheduled weekly from now through the end of September. As you're working on application ideas, feel free to drop into any of these office hour sessions and ask your question at the link shown here at the bottom of the screen. You'll see this link also on the S4A website. So feel free to do that as you're working on your applications. Okay, as promised, we are now at the Q&A portion of today's webinar. So I'm going to turn to our Q&A box, and just a reminder, if you want to submit a question, you should see a Q&A box at the bottom center of your Zoom screen. Click on that, type in your question. We'll get to as many of these as we can. If we run out of time today, before getting to all of these questions, we will send out written responses to these questions as well. We'll also update our FAQ page on the website based on questions that come in from today's session as well. Okay, first question, what is the exact meaning of the phrase system alignment approach? Good question. You will, for one thing, I'll say, check out our FAQs, because you will see a written description of how the S4A program defines system alignment approach. In general, we have a broad definition. It means any type of approach that helps entities working in medical, social, and public health systems align their work and work together toward a common cause. There can be many different ways of helping to support a system alignment approach. It can involve sharing information or data or communication. It can involve some type of shared governance or decision-making structure. It can involve some type of shared workforce or a shared technology approach, and many other ways. So we use a broad definition of system alignment approach. It's any action or set of actions that help actors operating in these three different types of systems, medical, social, and public health systems, work together, coordinate their actions. And for us, for this program specifically, it's coordinate their actions toward the end of advancing health equity and dismantling forms of structural inequity and structural racism embedded in delivery and financing systems. Thank you for that question. Again, more info on the FAQ page as well. Next question, is there equal emphasis or value on applications with approaches that address systematic racism or systematic health inequities, not necessarily racism? Or is racism a key issue that should be addressed? Good question. I would say systemic racism or structural racism is a major area of focus for us with this call for proposals. So we encourage you to think carefully about your idea and how it might be relevant to forms of systemic and structural racism, and how your alignment approach you're interested in studying is potentially relevant to dismantling those forms of racism. So structural racism, systemic racism is definitely a key issue, a key area of emphasis for our call this year. There's more description of that in the CFP document, even a link to some recent literature that helps to better define What do we mean when we say structural racism or systemic racism? Great question. Next question, does inclusion of academic research institutions in a consortium significantly enhance the ability of the applicant research teams? It's a good question. I would say it's not essential to have an academic institution, but this is a research program. So your research team needs to include people with relevant research expertise. And we definitely recognize that it's not just academic institutions that do research and that have people with research expertise. So it's not a hard and fast requirement. You've got to have a university or another academic institution on your research team, but you need to have people with research expertise and experience on your team. Those people can be embedded in many different types of organizations, both research and practice organizations, both academic and non-academic institutions, and community-based organizations that do have people with research expertise as well. So it's more about the people and their expertise. It's less about, we're not bean counting types of institutions and wanting to see universities on every application. Good question. And I say we are interested in seeing applications from places and institutions that don't often apply for these kind of opportunities. And certainly we're interested in applications from institutions that have not previously submitted to the S4A program. It's all about innovative ideas for system alignment that can tackle health equity and structural racism issues. Great question. Okay, next question. I represent a coalition of emergency management, public health, and healthcare systems collaborating to improve preparedness and resiliency. Would this opportunity be suitable for a multidisciplinary preparedness resilience proposal? I would say, in general, absolutely. You've got the multi-sector approach, already embedded in your coalition. So check that box off in terms of what we're looking for. You've got the relevant entities from all three sectors engaged in your coalition. If you've got an innovative idea for aligning systems based on your work that's specifically targeted at addressing health equity issues around preparedness and resilience and issues of structural racism that come up in the context of preparedness and resiliency, then you could be well positioned for this opportunity. Next question. Are the 2022 proposals supposed to hit each bullet on slide 6? Or are these criteria more generally speaking? Let me go back to slide 6 here. So in general, so for this slide, these are things that really, every proposal should try to address or incorporate. These are kind of key ingredients of successful S4A studies. So I would say, you want to look carefully at how your proposed idea could address each of these elements. The only caveat I would say, the last bullet point here, where we talk about these special areas of interest, you don't need to address all of the special areas of interest that we articulate there. The 5 areas for future development, you don't need to address all 5 of those areas. But these other elements are definitely core elements of the S4A program that we want to make sure to address. Okay. Next question. When you say causal effect, are you referring to a randomized control trial specifically? Well, certainly. That's one reason why we like RCTs, is that if they're designed well and they're executed appropriately, they are designed to give estimates of causal effects. But we recognize that any good social science or health science researcher, randomized control trials are not the only means to producing, to studying the causal effect of an intervention program or a policy or a system alignment approach in our case. So we are certainly open to any research, any scientific research design and approach that can support inferences about the causal effect of the strategy that you're studying, including the wide array and say growing array of study designs that are considered often considered to be quasi-experimental in design. We're not randomly assigning people to interventions, but you're capitalizing on natural ways in which people or communities or organizations sort themselves into different levels of exposure to the system alignment strategy that you're studying. So certainly we're open to a wide variety of research methods that can support inferences about the causal effects of the system alignment strategy. And this is all only relevant to that second category of award, the impact category of award. So good question. And there's more discussion of that issue in the CFP document as well, the funding opportunity brochure. Next question. Would a project that addresses gender disparities in health equity be a good fit for this proposal? I would say absolutely. Gender disparity is a very important dimension of health equity in an area that where we are as a society in clear need for more and stronger evidence. That being said, as you read the CFP document, we have a major focus in this round on studying issues of systemic and structural racism. And so I would also encourage you to think about how gender may overlay and intersect with issues of structural and systemic racism, and how the system alignment strategy you're thinking of studying might address that intersection of gender with these forms of structural and systemic racism. But certainly gender equity and gender disparities are of keen interest to this program, and certainly very, very relevant to the S3 program. Next question: would you be open to a proposal enacted in educational setting? I'll stop right there and say absolutely, absolutely. So if you read how we define these three broad sectors of medical care, public health, and social services, that social services sector, we have a broad definition and definitely include education settings across the full continuum as part of the as part of social and community services sector broadly defined. So definitely interested in system alignment studies that engage education settings and sectors and their work. Very, very important, obviously, to health and health equity. Next question: does the 2019 updated research agenda also apply to this call? Yes, that research agenda last updated 2019 is our currently active research agenda. So that's the one that we would encourage you to take a look at. We update that research agenda generally about every 2 or 3 years. So we'll be entering a time in the next year or so we'll update that, meaning we look back on the findings that have been produced by the S4A program and by other relevant research programs over time, and then think about updating our priorities based on what we've learned already and what where the remaining gaps and uncertainties are. But our 2019 agenda is our currently active agenda. Next question: transportation access or lack thereof has a huge impact on health and social well-being. You have declined to fund this issue in the past. Has that changed? I would say not true. We have definitely funded S4A studies that tackle issues of transportation and that use system alignment approaches that focus heavily on transportation. We funded some great studies in this area currently, have several that are still ongoing, and we'd love to fund more. So transportation is also a part of how we define the social services sector. We definitely included services and supports to assist with transportation needs. Good question. Okay, does the CFP require evaluating structural racism and inequity? this funding will support studies that examine the impact of system alignment strategies on forms of structural racism and inequity that have been identified by the applicant as the problem to be addressed. So certainly for the impact award category, the larger category of awards, we are looking for studies designed to evaluate the impact of the proposed system alignment strategy on forms of structural racism and inequity embedded in the delivery and financing systems of interest. So that is an important, very important part of the focus of the CFP. I would say for the first category of awards, the developmental awards that are designed to support pilot testing and feasibility approaches, you'll see there as if you read the language of the CFP, the funding opportunity brochure document, you'll see for the pilot test studies, we're looking for those pilot test studies only to test for feasibility and to evaluate the potential of the system alignment approach to address the forms of structural racism and inequity identified in the application. So we don't expect small scale feasibility studies to be able to study impact on structural racism, but they should at least be able to study the potential of that system alignment approach to tackle those forms of inequity. And again, more information about that is outlined in the written funding opportunity brochure. Okay, next question. Programs that can be put into action. Could you illustrate how you see this happening? How quickly do you think this can be done? Why do you think that? Good question. Well, research studies are designed to produce findings. This particular study, studies under this program are designed to produce findings, new knowledge about how to align systems. And those studies can be successful. They can produce knowledge about successful strategies, and they can also produce knowledge about unsuccessful strategies, things that don't work. All of those are types of new knowledge can be useful and be put into action on the ground by stakeholders working in medical, social, and public health systems. Many stakeholders now are actively trying to find ways of aligning their approaches with their colleagues in other sectors to tackle social determinants of health. And so many ways in which findings can be put into action. For example, studies may produce implementation guides, particularly if a study finds their system alignment strategy is successful in aligning, in helping these sectors work together and tackle health inequities. They should work toward producing an implementation guide that would provide a kind of a step-by-step approach for others to actually implement the same alignment strategy that was tested in the study, so that it can be easily replicated in other settings. And that's part of, you see, that's part of what we expect from studies that receive funding on this program, is that they not just produce scientific journal articles, but they also produce resources that can help stakeholders make use of the evidence, implementation guides, toolkits, decision-making aids that can help stakeholders in these various sectors think about how they can align their approaches by using the findings from the study, both findings of successful strategies as well as, in some cases, findings of unsuccessful strategies that perhaps should not be tested again because we've learned that they don't work, or at least they don't work in certain settings. So good question. Again, we encourage you to read the CFP again, where you'll see greater discussion of what we mean by research translation, what kinds of products can actually help people make use of research findings. Again, that concept of designing for dissemination that we encourage studies to follow. Okay, we've got a couple more minutes here. I'll try to get through a few more of these. Can you define operational expertise within the research team? Yeah, good question. Operational expertise, we mean people who know how the delivery and financing systems being studied actually operate. Medical care, public health, and social services, whatever the operational context is for your study, If you're implementing a alignment study involving schools, you need to have people on your research team who know how schools operate, how they implement their work, so that you've got people on your team who can help to navigate issues of how we implement the system alignment strategy in the settings that we propose to engage in the study. So that's what we mean by operational expertise: people who know how the delivery and financing systems relevant to your study actually operate on the ground, who've got implementation knowledge, and can help the study address those issues. Next question: to what degree are the changes being made in the program that result of what you and all of us learned during the pandemic? So certainly, the pandemic has been, an opportunity, multifaceted opportunity for learning both about opportunities and constraints of helping health and social service systems work better together. And so I would certainly encourage, applications that propose to leverage new learning, new ideas that have come out of the pandemic and as a result of responses to the health and social and economic challenges created by the pandemic. And we recognize it's not over yet. So there are certainly those kind of opportunities, and would encourage you to think creatively about how best to do that. You might say you might want to look back 2 years ago. We actually funded our 2020 call for proposals focused explicitly on system alignment strategies to address issues around the COVID-19 pandemic. Those studies are still ongoing, beginning to produce findings now. So you might want to go on the website to look at those previously funded pandemic-related SRA studies that we funded beginning in 2020. Last question: do we need to have preliminary data? Yes, if you want to apply for the second category of award, the impact category of award. In that case, you do need to have preliminary data specifically on the feasibility and acceptability of your system alignment approach. So we're at the bottom of our time together. I will say, for questions we haven't gotten through today, we will post written responses to these on our website and email those out to everybody who registered for us today. Thank you to everyone who joined us for today's session. Again, feel free to look forward to our recording that will be going out to everyone today. And we look forward to hearing from you. Thank you so much.